Dr. Edward Shapiro. He practices dentistry in Nipomo, California. Dr. Shapiro is a 1978 graduate of Baylor College of Dentistry. He completed the medical acupuncture program at UCLA of Medicine in 2009. Dr. Shapiro promotes his practice of dentistry and acupuncture to educate his patients on how important dental health is to their entire state of overall health. With further ado, Dr. Shapiro.
Thank you very much. So when I was asked to do this, I thought, wow, this is great. And then I started thinking about how I was going to condense acupuncture into 45 minutes, which is daunting. So what I'm going to do is I'm going to make a statement because it's relevant to dentistry. Pain, all pain, is due to a blockage of qi and blood. Remember that. That's a very important concept. We'll go from that. I'm going to give you a little history about acupuncture. I'm going to describe the functional parts of acupuncture. And I'm going to bring it forward into a few treatment philosophies and hopefully give you an appreciation of why acupuncture is so relevant to the practice of dentistry. My cactus friends here on the front page, they enjoy acupuncture in the sun. So I'll try not to read this, but to start with, I will just a little bit. Acupuncture is a method to balance the physical, the spiritual, and the psychological body into healing. And if you practice acupuncture, you will become a healer. That is an absolute given. It's the greatest part of it, quite frankly. You incorporate widely accepted methods of diagnosis and treatment for TMJ disorders. That's a great use of acupuncture. That's how I got involved with acupuncture. You can facilitate dental material usage as far as placement and removal, detoxification. I can't think of any more valid way to evaluate a patient on keeping them healthy in removal of mercury and other heavy metals from the body. Most of you are already aware of that through the VOL charts. That's a beginning, not the end by any stretch of the imagination. You can use it to reduce and eliminate pain and inflammation in the head and neck. The concept of bone cavities, which is always a big issue in our field, its validity, its non-validity, treating it is an acupuncture term known as an interference field, which is also a VOL term. It's also a term that spills over into the osteopathic medicine world. It's called facilitated segment, and it's exactly the same thing. Okay. This lady here, laying here very comfortably, as you can see, she looks like she's just enjoying herself, but actually, if you know what's going on with these points, this woman most likely is suffering from a significant amount of head and neck pain. She probably has some severe inflammation, and she probably has some infection just by those points. And I won't go over that, but just you will know if you proceed with understanding points and what they're used for. From just the points that are used, you can have a quick understanding exactly what a patient is suffering from almost 100% of the time. And she could be also having, you can use needles for facilitating like facial rehab, for like facial uplifts. It's very, very, very effective for that too. But it would be a different type of needle in these. Okay. The acupuncture diagnosis and development developed, as many of and all of you know, from the Chinese. And it developed from our realm in the oral cavity. And so we as dentists, we have the opportunity to practice acupuncture every time we look into a patient's mouth. As a matter of fact, since the first day of dental school, you have been practicing acupuncture. By looking in the mouth, evaluating the quality of tissue, and making assessments of that patient. From the first time you did a local anesthetic injection intraorally, you were actively practicing acupuncture when you did that injection. That is an acupuncture procedure. So if you look at the different tongues, what we're looking at are things like cracks down the middle of the tongue. That's a very significant finding in the realm of acupuncture diagnosis. When you see a central crack, you're looking at somebody who is very depleted. They won't respond well to treatment. You will have problems with this patient healing. So beware of the patient when you look at their tongue and you look down the middle of it and there's a huge crack. Just know that you have a patient that is compromised. Almost in every, I can't think of any exceptions to that. When you have cracks that extend down the middle and out to the different sides of the tongue, the horizontal cracks aren't nearly as severe as the cracks that go right down the long axis of the tongue. You'll be looking for things like the color of the tongue. You'll look at the lateral border of the tongue, and you'll notice on this one right here that it looks like there's scallops. This patient has a problem with what's called spleen energy, and this has to do with regulation of people who have fibromyalgia type problems, a lot of chronic fatigue issues. You'll see a lot of TMJ patients who'll have this pattern right here. And the good thing about these patients is they respond very well to treatment and usually very quickly. Sublingually, you look at the quality of the varicosity underneath the tongue. If you see big blue veins, know that you have somebody who has a lot of stagnation throughout their system. Their circulatory system is not usually doing well. It usually will relate back to liver. Liver in the realm of acupuncture has to do with management most of the time of emotions, especially the emotion of anger. And anger will kill. There is no way around that. So know when you see somebody who has a lot of big varicosities, and if you take a look right here at the end of their tongue and it looks bright red, know that you have somebody that you're dealing with who is not managing their life very well from a standpoint of anger. They may not tell you that they're angry. They may not even know that they're angry, but they're angry. So if you have that type of patient, you probably are dealing with somebody who will not accept what you're telling them very well, and they will probably want to try to micromanage you in their treatment. So just kind of some things that you can tell by looking at the tongue. The tongue gets even more specific than that. The back of the tongue or the base of the tongue is the realm of where the kidneys are viewed. When you look into someone's mouth and you can see a lot of people, you'll see kind of a heavy, thick coating on the back of the tongue. A lot of times they'll have bad breath. That's where their kidney energies are really usually depleted, or they can have a lot of issues with emotions too. It can show up that way. The middle of the tongue is where I've already told you it has to do with, it's important with the crack, but this area right here is the stomach and the spleen, right here in the center. The liver shows up here on the side of the tongue, the lungs up here along this border here, and the heart is right here at the tip. And so when you're looking at the tongue, you can certainly tell which organ systems are under duress. And there's a lot of different qualities that people literally spend. There's courses that are just taught on different aspects of looking at this. So, but from our standpoint, you can know a few basic things, and you can have a great understanding of what type of patient you're dealing with just a quick view into the mouth. The next major part of diagnosing in acupuncture is the pulse diagnosis. I don't know how many of y'all have had this done. And it's not about counting pulses. It's about finding the quality of all of the major systems in the body. So if you want to, here, if you can hear me, I'll demonstrate this for you. Take your non-dominant hand, take your index finger. It's probably better if you can grab somebody next to you. So take the other opposite hand. Yeah, you got that? Okay. And, well, so you're going to take your index finger and place it on the styloid process right behind your thumb. It's that bump right here on your wrist. And then take your next two fingers and lay those down right behind it. and feel for the pulse. And you'll feel it maybe under one of the fingers, maybe all of the fingers. You can move your fingers around and try to get it to where you feel it go across the entire spectrum of these 3 fingers. Then slowly push down until you feel the pulse disappear. And you may have to push pretty hard, and it'll disappear. Then very, very slowly, with all 3 fingers with the same amount of pressure, slowly let up. And with the first place that you feel the pulse, stop right there. And then make a mental note, is it under the back finger? Is it under the finger that's most distal over the process right here? Okay? That's the first step on the diagnosis. If you're on the right hand, you're feeling kidney, the yang expression of kidney energy. You're feeling the spleen, and you're feeling the lung energy. If you're on the left hand, you're feeling the yin aspect of the kidney. You're feeling the liver, and you're feeling the heart. Okay? Basic diagnosis. So what you do is once you understand what you're reading, and you make notes as to what you're feeling, what pulse comes up, what the quality of the pulse, does it feel like it's wiry? Does it feel like it's slippery? Does it roll back and forth? Does it jump up? Is it thin? Is it thick? And these are all different qualities that you can learn very quickly, or differences in pulse. And these will tell you if you have deficiencies or if you have excesses or somewhere in between. And acupuncture is a process of basically balancing the differences between deficiencies and excesses. That's really all acupuncture is. It's taking what the patient presents to you via looking back in their mouth and ascertaining that, taking a pulse, making a determination of where these deficiencies and excesses exist or don't exist, and coming up with a plan to balance those excesses and deficiencies. It's amazing how quickly, as dentists, we pick up on this. When I was in this school at UCLA, I was in class with 300 physicians. And I was pretty intimidated. I'll be real honest with you. It's been a while since I've been in school. Most of these guys are neurosurgeons, they're anesthesiologists, orthopedic surgeons, every kind of physician that you can think of. And, you know, a lot of internists, a lot of people who knew a lot of medicine. Well, one thing I found out real quick, us as dentists, we know a lot of medicine, way more than we give ourselves credit for. But the other thing that we have that our physician friends don't have is we know how to touch patients. They do not. For the most part, there's a whole population of medical doctors, their whole job is writing prescriptions. Or when they do touch a patient, they're asleep. So they were at my table trying to figure out from me how to examine a patient. A lot of them just really had never ever touched a patient in a way where they were really trying to ascertain these fine details, which I found, you know, quite remarkable. So as dentists, because of what we do, because of how we handle patients, we are already attuned to this type of philosophy and treatment. So it comes very, very natural to dentists to do this. Speaking of exam and history, I throw this in to basically just let you know that when you do an exam from an acupuncture standpoint, you do have to really ascertain the entire body. And as dentists, we both all know that we are, you know, probably shouldn't be doing pelvic exams, and we don't have to. And you should be, if you're a male, you should certainly have a female in the room when you do an exam with you if you have a female patient. And you just have to use good common sense, but once you learn where the anatomy of the acupuncture system runs, you can get enough of an examination as to where the tensions in these systems do set up in the legs and the hands and feet, to where you can make a very detailed diagnosis that will work very well for you in treating dentistry. Most of the points that we use in dentistry are from the elbow down to the end of the hand and from the knee down to the bottom of your feet. They're very similar to the vul points that you see on the charts, and the reason that those points are used as you go externally or distally in the human body, the energy or the chi becomes more external. It becomes more accessible. So the energy is very accessible to treat from those locations. So it's very easy to treat acupuncture by just basically hands and feet. Or you can treat from the ears, or you can treat from the scalp. There's a whole variety of ways to approach the acupuncture system that are valid systems within themselves, and I'll touch on those as we go through the presentation. Okay, I thought it'd be good that I would bring over what the actual parts of the acupuncture system are and give you a definition, because people often ask me what these different parts are. They're the chi. And what is chi? Chi is thought to be vapor. Now, you probably say, what is a vapor? Well, vapor is an energy. It's an energy that exists between the mind and the body. So there's a mental part of it, there's a physical part of it. And chi can be very subtle, where it's very ethereal, or it can be very, very gross and very, very right in front of you, too. So chi is what flows within the acupuncture system. And it's spelled Qi, and it sounds Chi. Then you have the acupuncture points. My little guy here, the little dots all over here are acupuncture points. And what the points are, they're access areas on the body where you can access into or gain treatment into these different pathways or meridians where the chi runs. So it's a point that has a certain characteristic to it. Each and every one of them are different, and there's literally hundreds of them to be able to gain access to the acupuncture system. The lines on the body are the meridians. These can be thought of like nerve pathways, but they're not nerve pathways. They actually run in between the tissues and the organs, in the clefts, if you will. They don't run generally along with nerves. They're not synalogous to nerves. And they are three-dimensional. That's a point I really want to make here is we all think that because of the representations that we're dealing with something that maybe runs along the surface of the body. And nothing could be further from the truth. And this is very true in the head and neck, especially in dealing with dental acupuncture. Because we all think that we want to deal externally, epidurally or into a muscle, like maybe the masseter or whatever, to gain like a trigger point. And you're literally every time you gain access to a meridian, you're literally really treating a plane of energy within the body that relates to every other plane in the body every time you access this. So it's a concept that you just have to gain. You'll gain an appreciation of it as you work with it more and more. I also think that because a lot of us have used the vul system, and that's how I got started in acupuncture, and the vul system is a linear relationship. I think we get in our mind's eye that we're dealing with something very linear, and it's not the appropriate way to look at it. And if you really want to make full access of this system, you have to bring into the concept that there are three dimensions, that there's a physical aspect to it, there's a mental aspect to it, and there is a spiritual aspect to it, and it cannot be ignored. Then there's yin and yang. We've all heard of yin and yang. Yin and yang are basically the balance of two different aspects of the same energy or chi. And the best way to think about this is if you think of a day as being 24 hours, and the entire day is the chi. The light part of the day is the yang part of the day. The dark part of the day is the yin part of the day. Okay? Daylight is still day, Nighttime is still day, even they're the same, but they're different qualities of the same thing. The other thing that you need to realize with yin and yang is that they are in a constant state of being dynamic. If they ever do become static, you're dead. And that's really what the problem is around root canals from an acupuncture standpoint. An acupuncture procedure is a procedure of mummification. It represents absolute yin. Absolute yin is not a state that is sustainable in a human living body. So that's when you do a root canal, even if it is acceptable from all the principles of dentistry, extract nerve, bones healing, from the acupuncture standpoint, it is creating an aberration in this balance of yin and yang. And it very well can, and many times does, represent the difference between you having success in some other treatment and not, or some other condition that this patient very well may be suffering from. The lack of success can very easily, and many times does, due to the disturbance in here between the yin and the yang when you have the absolute yin in the human body. Now, there's all the other issues that are brought forth, too, that Dr. Huggins, who is here this weekend, has brought up, and thank God he has, with all the different chemicals that are formed from root canals, and those are problems too. But from an acupuncture standpoint, it has to do with this dynamic state of yin and yang, and the fact that it is absolute yin, which is not a sustainable state. Then you have blood, and blood and qi are very closely related. The statement in acupuncture is that qi is the mother of blood, but blood sustains qi. And this gets back into this concept in meridian medicine is that there is nothing that is linear. So it's just it's a concept that you'll have to develop over time, and each and every one of you will develop it in your own way as you work with this or don't work with this. What's beautiful about acupuncture is you can go use it very superficially and get great results, and you can become the most profound diagnostician and treatment doctor in the world and get great results and be good for your patient on all levels. So it lets you go to where you want to be, and it's really a very rewarding way to practice because of that. The last two are fluid and essence. Fluids are everything in the body that's a fluid that's not blood. It's very, very related to blood. Things like urine, saliva, tears, every other fluid you can think of is in that category. And essence is a form of qi that we receive from our parents when we are born. It's called prenatal qi. Then it comes into our body through our umbilical. It relates closely to the kidney energy, and it's the most ethereal of all of the different energies. It's our life force, if you will. It's what it comes down. It's what God gives us, and so it's something that's very hard to increase in a human being. It changes very slowly. This is I'm going to speed this up a little bit because I feel like I'm falling behind here. And there's a continual circle of energy that's going on all the time. It extends out to the fingers, the legs, the feet, the anatomical position for acupuncture and yin and yang is hands up like this. The more medial you get, the more yin it is. The more lateral you get, the more yang it is. The top of your head is the most yang aspect of your body, but it is yin to the sky. Your feet are the most yin part of your body, but it's yang to the earth. So everything is relative to each other. Nothing's absolute. And so when you're dealing with yin and yang, you have to keep that in mind. And there are laws and rules by whatever different type of, whatever philosophy that you choose to practice, they all have definitions on how to deal with yin and yang. That's part of what you learn when you learn to do acupuncture. Meridians, there are, let's see, I think there's 12 major ones. These are the ones that we use in dentistry. They're the most effective. You have kidney and bladder. You have heart and small intestine. These here, they're called Xiao Yin, and they match up with what's called Tai Yang, which are bladder and small intestine. Kidney and heart are the Xiao Yin part. And what these are about is they literally define which area of the body these meridians run. Like I said, the most yin is central, the most yang is the outside. So like small intestine runs down the outside of your arm. Okay? Bladder runs on the outside of your leg. Okay? Stomach runs right down the middle. Okay? So all of these and their names are just anatomical ways to know which meridian and where it is located on your body. Then I break them down into the major yin meridians: kidney, heart, spleen, lungs, liver. Master of the heart, or pericardium, or better known to us, a way to think of it is sympathetic nervous system. Okay? And then the Ren conceptual is right down the middle. And that's, I talked about essence a while ago. That's where essence comes into play. The major yang meridians are bladder, small intestine, stomach, gallbladder. Triple warmer is the pair to the pericardium, or this is the parasympathetic side of the nervous system. It relates almost directly to that. And then you have the governor vessel, or Du, which runs right down the middle of your backbone. Okay? This is just another representation of where these run along the body. This is your this is the master of the heart. Here runs right down the middle of this side of the arm. You've got your kidney that runs from the yin surface, medial surface right here, up the inside of your leg. And the gallbladder, which is part of the liver meridian, the yang expression of the liver meridian, runs from your second toe right up the outside of your leg. This is extremely important in dentistry, ladies and gentlemen, because this is about 99% of all your TMJ problems right here. And if you treat TMJ and don't take into account something along what's going on with this meridian, if you're getting success, you're lucky. And that's just the truth of it, because this meridian has incredible influence upon the TMJ through this system. It is unbelievable the amount of effect that the gallbladder meridian has on temporomandibular issues. Lung, liver here, and this is the large intestine, and lung runs right here on this here. This is very important to us, because if we've been followers of the Vole technique and reading the lymphatics, the points that are read with the Vole machines, basically you're reading into the lung and the large intestine meridian, which is really probably pretty appropriate because it's yang energy. It's very, very superficial, which is very synalogous to the lymphatics in the body. So that's why Dr. Vole used those meridians, is because in the scheme of acupuncture philosophy, it is coincidental with the very external parts of the system that can be readily accessed with those instruments. These are more of the same. It's just where these locate, which surface of the body. The stomach, yang ming, runs right up the middle of the front, just as it does the middle of the body here intraorally, right in the middle of the body. And if you have a stomach deficiency, which is very, you see a lot of in patients you'll see it right in the middle of the tongue. So not only does it run up the middle of the leg, the middle of the abdomen, the middle of the thorax, the middle of the tongue. So that's kind of the way this goes. This slide is a list of different philosophies that, and this is just a partial list of the different ways that you can go about acupuncture. You can treat something as simply as putting one needle in one point, and you can get a therapeutic effect. You probably, if you've looked at acupuncture at all, the 5 phases are the circle that you see on the wall that have the meridians with the arrows going one way, and then it has a star in the middle, and that's the 5-phase diagram. And that's a very common way that the practitioners of Oriental medicine, they use it. It's very good for internal medicine. So in our realm, probably not as important. It would not be something that in a active dental practice that I think you would be using a lot. The principal meridian system is mainly what I was taught in the medical acupuncture course. It gives you access to these meridians from the elbows and knees outward. It gives access to the different meridians and the acupuncture points in a way that's very as linear as it gets in the acupuncture system to balancing out the different elements of the body: fire, water, earth, air. And ultimately that's part of the yin and yang thing of balance, but that it's a very, very effective way to treat dentally, and it's a very great way to keep yourself getting great results, especially in surgical pre-op and post-op. If you use the principal meridian system pre and post-op, you will not have any problems with post-op infections. You will not have dry sockets, and you will not have cavitations. Shumu system is on the front of the body and the back of the body. It's very effective to the organ systems. Not something that we would probably use a lot in the dental office, except maybe a point here and there if you just needed to, but not something I think would be actively pursued. Curious meridian system is a system that looks at the body in 3 different axial planes. It's very effective with like female PMS issues, that sort of things, dysmenorrhea. It's also very effective with not being able to be pregnant. There's been a lot of children born because of practitioners who know how to use this system. It's very effective. Tendon neuromuscular system is just an absolute wonderful, wonderful thing. It is an access into the outermost superficial aspect of our immune system. Any type of acute trauma, this will help things heal quicker than anything that I know. And it's very, very, 3 points is all you have to know. And it brings the energy of the full immune system right to where you want it to be. And you can get by a lot of long-term issues with healing if you make use of this from day one. Extraction of a tooth, any kind of mouth trauma, periodontal surgery, whatever. It's very, very effective. The distinct meridians is another system very good at getting at people that have maybe, like, say, hepatitis, organ dysfunction long term, not something that you're going to want to probably deal with as a dentist. Then these last 3 are very important because these are acupuncture systems that are complete systems of treatment within themselves. The auricular or ear, the scalp, and the hand. The auricular is pretty much a French development. They were, from their experience in Indochina, Vietnam, before we were, that they took acupuncture from the Chinese and basically came up with the auricular. Scalp is a Japanese form of acupuncture. It uses strictly points on the scalp, and it's also very, very effective. Hand is also another way of doing this. You can do all of the treatment just off of the hand. I'm going to pass out. You guys can just going to hand these out. These are different needles, and these are the variations. This is just some of them. Everything from doing, say, somebody who has a sciatica with some of the longer needles to in the little packages like the hand and the auricular, the ones that are in the little plastic holders that have a little gold tack on the end of them, those are used for ear. So these are the kind of different variations in dental needles that are out there and accessible, and you can make use of them in your practice as you see fit, what works for you. Goal of treatment, as I told you earlier, all pain is due to blockage in blood and qi. So the first thing in treatment you're going to want to do is increase the flow of blood and qi. You're going to want to decrease the excesses and increase the deficiencies in the organs, in the meridians, and in the function in between. You're going to create the harmony between yin and yang. And then adapt all of that to the patient's pathogenic factors, taking into effect what's going on with them medically, what medications they're on, make adjustments for that. And that's how you come up with an active, complete treatment for acupuncture. And you can apply that to any one of those previous type different philosophies. I know that's a lot to kind of throw, but it's just trying to give you an overall perspective of what, as a dental acupuncturist, you have to do. It's really not daunting at all. I have forms I go through real quick when I'm assessing the patient in my office, and it takes me 20 minutes, and that's from top to bottom. Here are uses of acupuncture in dentistry, controlling pain, I've talked about. You can enhance anesthetic. I get this question all the time. Can you do dentistry under dental acupuncture anesthetic? The answer is yes, you can, but the problem is that you feel pressure, and a lot of people perceive pressure as pain. So if you have a patient who's mentally in the right spot, yes, you can, and it does work. But in the Western American culture, there's probably a lot more people who can't do that who can do that. It's better as an adjunct. It's kind of like the thumpers on the needles and all the diversionary things that we have in dentistry now. Acupuncture is a great diversion. You can set it up. You can hook TENS units to it. You can pulse with it in 1,000 different ways to create whatever kind of diversion that you want to. You can increase endorphins. So there's a lot of tools that you can use with anesthetic in dentistry. You can use it to stimulate the immune system. I talked about the tendinomuscular. I cannot overstate how incredibly helpful that technique is. You can use it for bone regeneration. A lot of the problems that we see in periodontitis, periodontosis, are related to energetic aberrations within especially kidney energy. Matter of fact, all bone is underneath the control of the kidneys. And so that's one of the reasons why in people my age, approaching 60, you see horizontal bone loss in the anterior segment. This is where the kidney energy comes into the oral cavity, and as we get older, we're losing, quote, our essence. We're starting to deplete, if you will. And so the result is your bone is less dense. In the ladies, you see the osteoporosis. And in the realm of treating the perio, you see decrease in bone heights and less density. And so it's a great adjunct to our active dental treatments that we do. You can use it to increase saliva. It's great for implants. It gets back to the pre and post, making sure that when you do these procedures that you have no blockages, that you have the deficiencies and the excesses back into the balance. You have the yin and yang doing as best you can get it, and then you do your procedures, and after you do those procedures, you follow up for a period of time, days, weeks, whatever it takes, and try to facilitate keeping that environment there for that patient to heal, and you will get better results. There's just no way around it. You won't. Managing many aspects of TMJ, both on every level, everything from the physical to beyond the psychological and spiritual. It just gives me a tool to be able to get my hands around these patients, and we all know how difficult they can be. If you don't think they're difficult, then you come to my place and I'll let you see some of mine. Inflammation, that's back to what we've already talked. And then the facilitation, detox of heavy metals. I know that there's a lot of different philosophies on that. My statement is whatever method you want to use, if you take into consideration the meridian health, and if it is set up so that the young, especially the young meridians, are not obstructed and they're open, i.e. The lymphatics are open, you will get markedly better results if you don't do it that way. So I don't care if you're doing IVs or you're doing reading, looking at hair and doing long-term chelation, which way you want to go. If you use this, you'll get better results. Other relevant protocols that are acupuncture, trigger points. That is acupuncture. Neural therapy. I don't know if you know what neural therapy is. It's a treatment of scars. And it's a scar tissue is the same thing as what a root canal does. It sets up an interference field. It blocks energy. And you can inject them with just local anesthetic without epinephrine. There's protocols to follow, and it will break down those energetic blockages, and you will get better results in what you're doing, both intraorally and extraorally. Prolotherapy is a therapy that is probably the most brutal thing I've ever experienced in my life. It is injection of ligaments and tendons to get them to shrink with irritants. I've had people put pumice into the ligaments in my lower back to stimulate inflammation so it would shrink up and my SI joints would quit hurting. And I tell you what, I'm a pretty tough guy, and it brought me to my knees for several days. But it's a form of acupuncture. Not one that I go by too often, but anyway. Then we have ear acupuncture and scalp acupuncture. The basis for the ear acupuncture and also the scalp and also the hand is what's called the homunculus. And you'll notice on the homunculus you have a form of the human body that reflects onto the ear. And you will notice on this one, right here is the skull, right at the bottom of the ear here. And this is the TMJ point right here, and you can put those, the needles going around, the ones that look like little gold tacks in the end of the little tubes, the little tubes with the black ends on it. You can put if you have somebody who comes in with a hot TMJ, a closed lock, whatever. I've watched closed locks unlock by putting one of those little tacks right there, all within itself, and that's all I did right there. Is that going to happen 100% of the time? No. But I have seen that happen, and they were closed locks. Why it resolved that much, I don't know. Was she macerated in the tissue? Yeah. She was closed locked. She'll always be, that to some degree. But my point is that you can get a lot of very quick results in a very short manner and give you time to manage a patient until you can come up with a treatment plan that that'll work for you and the patient long term. Other areas are great. You can bring in this is a great way if you like to be more broad in what you're doing and you're into things like osteopathy, or you work with a chiropractor or whomever you work with. You can bring in and bring active treatment to just about any part of the body right here. As a dentist, and it's all part of whatever you're doing as far as TMJ or even removing metals or whatever you're doing. You can bring in those philosophies by just nothing more than ear acupuncture. This is the homunculus of scalp acupuncture, and it doesn't show up, but it has the same thing. The body's right here, and these points are the same type of deal as we saw with the ear. And there's a little package in there. They have little bitty needles. I mean, these needles are like a 1/4 inch long, and you just go literally subcutaneous, and that's all you're trying to do is stimulate the subcutaneous tissue, and it makes profound effects on the entire body. 3 patients I want to talk about. The TMJ patient, how you deal with them with acupuncture, back to just some principles, thorough history and exam. Find the meridians and the points that relate to where the tensions are in your exam. Where does the patient hurt? Let them tell you where they hurt. Does this hurt? When Do they jump when you push on a point? Is it a trigger point? Whatever. Make note of those and then look back and see what meridian runs underneath that. It's pretty simple. It's not mystical. Once you understand a few principles, you can go right through this pretty quick and know exactly what you're dealing with from a standpoint of a patient that's emotional, or they've got some sort of trauma somewhere that's underlying this. Maybe they were whiplashed in a car and that's all they were. Or maybe they just don't like their husband and they're never going to be better, you know, and everything in between. So establish the treatment, eliminate the blockages, back to that. Create a balance in the acupuncture anatomy, splints, overlays, whatever you're doing, doctors, to facilitate your TMJ treatment, this works with. And then create your long-term prescription. What do you want them to do? Do you want them on herbs? Do you want them on, the doctor was in here before, vitamin D3 and all of its manifestations. You come up with a long-term prescription to support all of this. Same thing for the infected dental patient. I will tell you that the 3D tomography is a godsend for this because it makes it a whole lot easier to see these things. And it's the same process, so find out to the best you can where this thing sits. What meridian does it sit on? And how does that meridian relate into the rest of them based on whatever philosophy that you're using? Clear it. Get balance between the yin and yang. Do the surgery. Make sure that you get everything removed from there that's infected that you possibly can. Create a post-operative continuation of treatment so that the energy continues to manifest and help your patient heal. Use what the good Lord gave us, ladies and gentlemen, and your treatment will be a whole lot better. And follow up. It's just a process of that, and the results go up. At least they do in my place. This is about the anatomy of back to that deal about the 3D. The reason I threw this in here is because some of them are superficial, some of them are right on the bone, some of them are in the muscles. I mean, they're three-dimensional. So never forget that. Never forget that every acupuncture meridian, every acupuncture part is a representation of the body and the soul and the mind. This one was a little out of line. When we brought it over, for some reason it switched. But anyway, this is the heavy metal patient. This is the third patient with acupuncture. It's the same thing. Establish, look and see what the overall health is. Find out which teeth you're going to deal with. What meridians are they on? Look at the meridian philosophy that you're dealing with. Set up a detoxification program through the meridians. Make sure that you've got your yin and yang balance, the chi's flowing. Do your work. Do all the precautions. Use your filters. Use your ozone. Use your oxygen. Do everything else that you would normally do, and just put this in an adjunct, and your results will be better for you and your patient. And if you do this on yourself on a regular basis, guess what? You're not going to be affected so much by the residual effects of what you're doing for your patients. I know that because I got sick from doing it a long time ago, so I believe in it. And then create your long-term detoxification and keep, and if they're a patient that wants to, go to the hot yoga and sweat 3 times a week, but that works for them fine, or whatever works for your patient. Try to adapt what will work in their lives so that you can apply these principles. It's very, very, very malleable. These are just important acupuncture points, just so you know where large intestine 4. Here, that's the master control point of the oral cavity. Anything, and that's what Vole uses a lot in the Vole techniques. Large intestine 20 is here on the face. It's on the outer aspect of the alveoli on the nose, right here. The large intestine is the only meridian in the body that crosses the midpoint. It goes from one side to the other. It's the only meridian that does that, and there's a huge manifestation and energy from that. So the large intestine is a very, very important meridian from the standpoint of oral health. And a lot of problems that we see, especially infections, are related to problems with, guess what, the colon. Small intestine, 18, 19 are TMJ points up in this area right here. I use them a lot in TMJ. Bladder 10 is the back of the neck right in here. Cervical issues, back pain. Any type of back pain a patient has, you can use a point right here, bladder 10. You can come down to the outside of the ankle right here, right behind the lateral malleolus, okay? What is this? The lateral aspect of the body. It is the yang aspect of the body. The bladder meridian is the most yang of all of them. You can access it with a little needle right there and a little needle right there. And it's just like setting up a circulation. Think back to the yin and yang running up and back. You're just trying to facilitate that overall pattern on the macro scale and on the micro scale. And when you really have in your mind's eye, when you have that in your mind's eye, your treatment, your consciousness can really focus in on that. And that's what you want to do. You bring your consciousness into your treatment. You become present in the moment with your patient, and you demand that your patient becomes present with you. And that's a great way to treat. So small intestine 3 is a great, right here on, if you squeeze your hand right here, that's a great for patients that don't sleep well, insomnia, patients that have a lot of anger issues. You can get a lot of tension release there. Triple heater is back up to the TMJ area again. 18, 19, 23, and 22 are in this area here. Gallbladder 2 is at the bottom of the ear right here. You got a gallbladder point. This is a great TMJ point. Why? Because it's its location in relationship to the TMJ itself, but 2, because it's into that gallbladder point meridian. And that's stomach is very big. You got your stomach that runs from here, 6, 7, and 8 comes up to here, comes all the way down. It's huge in a lot of the things that we do. 2 minutes? Are we done? 1 minute? Okay. I think I'm done anyway. So anyway, the bowl chart, I brought that up because it got me into this. I'm sure it's got a lot of y'all interested in this too. It's a great way to know that dentistry and meridians are connected, but I don't think it's enough within itself. So when you start using it, try to start thinking about that this is really three-dimensional. Additional studies. There is a study out of USC School of Pain Management. Glenn Clark basically validates the whole concept of bone cavities. I almost fell out of the chair when I listened to the study, and that was here recently. Exploring the psychological effects of TMJ and our friends at the American Dental Association. It's a pretty good article. Acknowledgments, Dr. Joseph Helms, he's the physician who runs the physician's clinic through UCLA. He is my mentor. He's a great man. He's done a great service to humanity, and I give him all the credit in the world. And that's my contact information. Ladies and gentlemen, I hope I made some sense. I tried to make this to where it would make, hopefully, mean something to you. Thank you for your time.
Okay, let's thank Dr. Shapiro, and let's give you the AGD codes. It's ES, like in Sam, 1109, Paul, and Paul, PAP, okay? ES 1109, PAP. I just want to remind everybody that there's a speakers forum in Ballroom C at 4:30 for all the speakers, if you have any questions. And at 6 p.m. there's a welcome reception at Grand Ballroom E. Thank you.